Hello everyone, welcome to NG's Corner for Nurses. Hope all of you are doing well. Today we will discuss some prefixes which are used in medical terminology. Let's see. At first, we should know what is medical terminology. Medical terminology is the language used in healthcare to describe anatomy or the structures or conditions or diagnosis, procedures, treatments and much more. We all know learning medical words can be tough at first. It can almost feel like a different language. But if we break the words, it can really help to better understand the medical terms. Most medical terms have three parts: a beginning, a middle part, and an end part. So let's take a look at each part. First is prefix or the beginning of the word. It is often a descriptive part of the word. Prefix is not always present, but when it is, it forms the beginning of the word. It typically provides descriptive characteristics such as a location, direction, number, quantity, amount, size, or color. Not every medical term uses a prefix, and some words begin with the root. Okay. Next part is root or the middle part. It is the subject of the word. That means it gives the medical term its code meaning. If there is no prefix, then the root will be at the beginning. And think of the root as the subject of the medical term, and it often pertains to a body part or system. And the last part, that is the suffix or the ending part, it often brings meaning to the word. The suffix might indicate a disease, disorder or condition or procedure, process, specialty, test or status. Then let's see an example. The word hypoglycemia. This word have three parts: hypo, glycemia. Hypo is the prefix, glyce is the root, and emia is the suffix. The word hypo means less of something or below the level. Glycine refers to the glucose, and emia refers to something that is in blood. So what is the meaning of this hypoglycemia? That means low blood sugar or low blood glucose. In this session, we will discuss some common medical prefixes. First is mono. Mono means one or single. As an example, we can say monoplegia, that is paralysis to only one limb, or mononuclear cell, that is the cell with one single nucleus. Next is uni. Uni also means one or single. The word unilateral, that means one-sided. Next is bi or diplo. This means two or double. Biceps brachii, that a muscle which has two heads, biceps. Or the word diplopia, that means double vision. Next, coming to the tri. Tri means three or triple. As an example, we can say triceps brachii muscle. It arises by the three heads. That's why it is known as triceps. Okay, next is quadri. Quadri means four or quadruple. As an example, we can say quadriplegia, that is paralysis of all four limbs. Next is micro. Micro means small. We know the term microorganism, very small living creatures, or the word microscope, that the instrument that makes small things perceptible. Next is macro. As an example, we can say macronutrients. Nutrients that the body needs in large amount to function. And the example of macronutrients are carbohydrate, protein and fat. Next, coming to the megalo. Megalo means large or abnormally large. As an example, we can say megalocardia, abnormal increase in size of heart, which is also known as cardiomegaly. Next is semi. Semi means half. We know the word semi-conscious, that is the half conscious state or partially conscious state. Next is hemi. Hemi means also the half or one side. We know the word hemiparesis, that means weakness to one side of the body, or hemiplegia, that is paralysis to one side of the body. Next is equi. Equi means equal. We know the term equilateral, having all its sides of the same length. Okay. Next is iso. We all know the 0.9% normal saline is a isotonic solution. So what is the meaning of isotonic solution? Is a kind of solution that consists of the same salt concentration as the cells of and the blood. Next is U. U is U stands for normal. We know the term eupnea, that is normal breathing, or euglycemia, that means normal level of glucose in blood. Next is normo. We know the word normotension, or we often call often say the patient is normotensive. That means the patient having normal blood pressure. Next, coming to the word hyper. Hyper means above normal or excess, high or elevated. We know the word hypertension. That means the blood pressure is more than the normal range. Next is hypo. Hypo is below normal or deficient or low or decreased. We know the word hypotension. That means the blood pressure below the normal level. Okay. Next, A or am, which means absent or lacking. As an example, we can say apnea, that is absence of respiration, or aphasia, that means absence of speech, or anuria, absence of urine, or we can say anoxia, that is anoxia, that means lack of oxygen, or anemia, that is lack of blood. Okay. Next is pan. Pan means all. As an example, we can say pancytopenia, which means reduction in the number of almost all blood cells. Next is multi. Multi stands for multi-organ. Multi means many. Multi-organ involvement. That means involving more than one organs or all organs. Okay. Next is poly. Poly means many. As an example, we can say polyuria. That means excessive urination. Next is oligo. Oligo means few or very little. As an example, we can say oligouria. That means low urine output. Next is cyano. Cyano means blue. We know the term cyanosis. That is the bluish discoloration of skin, lips, nails due to lack of oxygen in body. Next is erythro. Erythro means red. And the word erythrocyte, that means red blood cells. Next is leuco. Leuco means white. We know the term leukocyte, that means white blood cells. Next is anti. Anti means before. We know the word antepartum, that means the time period before childbirth. Next is pre. Pre also means before. We know the term preoperative. Preoperative period. That means the period before a surgical operation. Next, post. Post means after. We know the word postpartum. Postpartum period. That means the time period after childbirth, or post-operative period. That means the period after a surgical operation. Next is retro. Retro means back or backward. We often say pancreas is a retroperitoneal organ. Retroperitoneal organ. Why? Because the pancreas is located in abdomen behind the peritoneum. That is the back of the peritoneum. Okay. Next is neo. Neo means new. Neonatal. That means newborn. Okay. Next is tachy. Tachy means fast. We know the word tachycardia. That means the heart rate more than the normal range. Next is brady. Brady means slow. We know the word bradycardia. That means the heart rate below the normal level. Okay. Next is AP. AP means above, upon or on. As example, we can say epidermis. That is the outer layer of the skin. Okay. Next is supra. Supra also means above, upon or on. As example, suprapubic area. That means above or over the pubic area. Okay. Next is sub. Sub means below, beneath or under. The word subcutaneous. That means under the skin, or the word sublingual, that means under the tongue. We know sublingual is a root of medication. And where we place the substance or place the medicine under the tongue, and the substances diffuses into the blood through tissue under the tongue. Next is infra. Infra means below, beneath or under. And the example is infracostal. That means beneath or under the ribs. Next is dextro. Dextro means on the right side or right. We know the word dextrocardia. That means when the heart is located on the right side of the chest. Okay. Next is anti. Anti means anterior, front or in front of. We know the word antenatal period. That means before birth or front of the birth. In front of. Okay. Next is antero. That is anterior, front or in front of. It means, as example, we can say antero-posterior. That is the axis from front to back. Or next, the word is postero. Here we can say, as an example, postero-anterior. That means the axis from back to front. Okay. Next is the dorsi or dorso, which means posterior, back or behind. As example, we can say dorsispinal. That means related to back and spine. Okay. Next is peri. Peri means around or surrounding. As an example, we can say pericardium, the membrane that surrounds the heart. Okay. Next is sarcum. Sarcum means around or surrounding. conduction. It is a movement of the limb. That is the rounded movement of the limb. Next, coming to the prefix endo. Endo means inside or internal. As example, we can say endometrium, that is the innermost lining of the uterus. Next is intra. Intra means also the inside or internal or inner or within. As example, we can say intracellular, that means within the cell. Next is exo. Exo means outside or external. We know the word exogenous, that means growing or originating out of the body. Next is extra. Extra also means outside, external or exterior or outer. As example, we can say extracellular, that means outside the cell. Next is ecto. Ecto also means outside or exterior. As example, we can say ectopic pregnancy, where the embryo implants outside of the uterus. Okay. Next is ab. Ab. Ab means away from. We know the word abduction, the movement of limb away from the body's midline. Next is ad. Ad means towards. We know the word adduction, towards the, here the movement of limb towards the body's midline. Okay. Next is trans. Trans means through or across. We know the word transvaginal ultrasonography. Here the ultrasonography is done and where the probe is inserted through vagina for pelvic imaging. So here the probe is inserted through the vagina. So that's why it is known as transvaginal ultrasonography. Okay. Next is para. Para means nearby or alongside or beside. As example, we can say paranasal sinuses. We know what is sinus. It is a small air-filled space in the bones, and where the sinuses are situated around the nose, those sinuses are known as paranasal sinuses. Next is juxta. Juxta means next to or side by side. As example, we can say juxta-articular. That means situated near a joint. There may be a cyst, that is juxta-articular cyst. That means the cysts are situated near a joint. Next is inter. Inter means between. As example, we can say intercostal. That means between the ribs. Or intercellular, that means between the cells. Next is ipsi. Ipsi means same. We know the word ipsilateral position. What is this ipsilateral position? In anatomy, it refers to the body parts on the same side of the body. As an example, the left arm and the left leg are ipsilateral to one another. Okay. Next is contra. Contra means opposite or against. We know the word contraindication. We often use this word in case of medications. That means the against the indication or opposite to indication. It is a specific situation in which a medicine should not be used. It may be harmful to the particular patient. Okay. Or the word contraceptives. It is a ways to prevent pregnancy. That is the against pregnancy. Okay. In next session, we will discuss some common suffixes of medical terminology. If this content is useful for you, then please put a like and share it with others. And for getting more videos like this, You can subscribe NG's Corner for nurses. And for any suggestions or for any queries, you are most welcome to comment. Thank you for listening.